Melbourne's COVID outbreak is reaching a critical point as case numbers swell in some of Victoria's lowest vaccinated areas. Across the state, more than 85,000 people received a shot yesterday. That's got us to 63.5% of eligible Victorians now with the first dose, while nearly 40% are fully vaccinated. 324 new cases were reported today, most of them in Melbourne's north and west. The rapid escalation has led doctors and community leaders to urgently call for more vaccine supplies, especially Pfizer, to be pumped into the northern suburbs. Leanne Wong begins our coverage.
Melbourne's northern suburbs are in a dire situation, with high case numbers and low vaccination rates, according to health professionals.
That combination is dangerous. It's dangerous for our vulnerable communities.
Dr Shiraz Markri has worked here since the pandemic began, and he's backing a call by local leaders for more Pfizer vaccines to be urgently sent to hotspots.
The vaccination rate in the north is less than any other areas, and we need to prioritise this.
There's been deaths in the community, which has been very sad, and what we want to avoid is more deaths and hospitalisation.
Of the 324 new cases, the majority are again in Melbourne's north and west. 195 are in northern suburbs, including Craigieburn, Glenroy and Broadmeadows, and just over 100 are in the west, such as Werribee and Altona North. The Hume local government area in Melbourne's north has one of the lowest vaccination levels in the state. Just 26% of the eligible population here has been fully vaccinated. Of the 111 Victorians in hospital, including the 32 in ICU, 99 are unvaccinated. The remaining 12 have had one dose.
We had no one in hospital who had been fully vaccinated.
To combat rising numbers, testing site operating hours in the north and west are being extended and a mobile testing truck has been deployed. The Islamic community wants more of its sites turned into pop-up vaccine centres. The government says more sites will be named soon, but argues vaccination rates have been hamstrung by allocations favouring Sydney.
I wish we had them. I wish I had last week's Tats Lotto numbers as well. I don't. We've just got to get on.
Whether it's the federal government or the state government, I don't think Victorians care less. I think they want governments, federal and state, to stop arguing.
But we just need more doses into people's arms.
The state government says it's engaging with the Commonwealth while preparing for a surge in hospitalisations. It's also hoping more can soon be done to protect children too. Here at the Royal Children's Hospital, 1,500 children are tested for COVID-19 every week. The hospital has now begun trials of a new testing device that's less invasive and just sits at the base of the nose. Over the next 6 weeks, 250 children aged 4 to 18 will trial this device and its results will be compared to standard testing. Leanne Wong, ABC News, Melbourne.
While most of regional Victoria is preparing for the easing of restrictions tonight, it's not necessarily going to be a snap back for many businesses. Some operators, particularly in the hospitality sector, are frustrated by the customer limits put on venues, and so the state government has made it too difficult for them to reopen. Sarah Lawrence reports.
Stephen Philpott's Warrnambool pub can seat over 460 people inside, but when restrictions ease in regional Victoria tonight, he's refusing to open.
And when the previous restrictions were in, it was 1 per 4 square metre, we could have 90, 100 people in here. 10 in the whole place. Like, it's just bizarre.
Under the new limits, hospitality venues will be allowed to have only 10 people seated inside and 20 outside. In Kyneton, cafe owner Daniel Richards has cancelled 68 bookings this weekend, also frustrated by the customer limits.
You've got 10 degrees on Sunday as a maximum, plus you've got 95% chance of rain. So where do you put those customers when it starts raining?
The focus of this set of measures, as cautious as they are, is hopefully a first step.
Those in the wedding industry are also suffering from the 10-person limit.
Quite expensive exercise to have just 10 people at a wedding when you're spending so much money on that special day. So people are not willing to do that, so we keep seeing people pushing their weddings further into the future.
Gyms are yet to be given the green light to reopen, despite being allowed to operate last time regional restrictions were eased.
We've been closed for over 200 days in the last 18 months, and whilst we do believe that this will come to an end at some point, it's it does take its toll.
Whether they open or not, businesses will be able to continue receiving support payments for the next fortnight. But even that process is proving difficult.
The funding support is so slow that at times you don't actually have the money to buy the food in.
But whether that support will continue is yet to be revealed. Sarah Lawrence, ABC News.